Hi, this is Dr. Kirk again. We're talking to you today at the St. Helena Women's Health Center about thyroid disease. Thyroid disease, wow. Super common. If you talk to your family, I bet somebody in your family, most often a woman, because it affects women significantly more than it does men, although it can affect both. But you talk, you'll find some family members, if not yourself, that have had thyroid problems. Thyroid problems can be multiple. And it's interesting, we call it the great masquerader. Menopausal symptoms, hot flashes, dryness, hair falling out, all of those things, they may have nothing to do with menopause and everything to do with the thyroid. The thyroid, like estrogen, I think I've talked about this in the past, thyroid itself, the hormone, comes in a couple different flavors, if you will, but those thyroid molecules that are necessary parts of our experience are made in the thyroid, and they're made in a relatively complicated way that connects the brain to the thyroid to release the thyroid stimulating hormone from the brain to allow the thyroid to release freely floating thyroid. There's a number of nuances about it, but at the end of the day, if you don't have enough thyroid, we call it hypothyroid. What happens? You gain weight, you get tired, you're sleeping all the time. You're not even necessarily eating, your metabolism slows. You may even get swelling in the lower legs, even significant swelling called myxedema, and it looks like the Michelin Man, but that's significantly advanced stuff. It may make you infertile. It may make your period stop. It's got a lot of things it does, because every cell in the body has a thyroid receptor on it, or thousands and millions probably of thyroid receptors on them. And without thyroid, they get affected, as is obvious by these symptoms. That being said, you can also have too much thyroid. That thyroid, in its process of going to become too low, often starts pushing out too much thyroid. And that can cause kind of the opposite. You'll lose weight without trying. Not necessarily the great weight loss program, because it can actually kill you. It can lead to abnormalities in your heart. It can cause significant changes and actually truly cause you to lose your life. So thyroid disease is not to be taken lightly. But thyroid, being the great mimicker, sometimes it gets missed. Sometimes we think about the zebras rather than the horse. This is more of the horse, because it's in everywhere, every place in your body, and it's needed. So what do we look for? Well, first of all, if you have these symptoms, and there's any likelihood, say an abnormal period, for example, or significant weight changes, or you're having real great difficulty sleeping and some other nuances, it's always a prudent thing to test the thyroid. And in most cases, a thyroid test is just a simple blood test. You don't have to fast. You don't have to do anything special. You just come to the doctor, we give you a slip, you go and check your blood test. Generally speaking, that blood test is a little more complicated than a single test, but from your perspective, they're just drawing your blood. We may look at 3 or 4 or 5 or more different types of products that your body is making or not making in order to find out what's actually going on. But the good news is it's fairly easy to diagnose once you look for it, and it's fairly easy to treat once you found it. Treating it is as simple as a pill a day. Nobody really likes to take pills, but trust me, the side effects of hypo or hyperthyroid, too much, too little or too much thyroid, are far outweighed by any remote concerns about taking a daily pill. And in all honesty, the pill itself is replacing the thyroid that you've lost for, if you are hypothyroid, for the lack of the thyroid functioning. So it's a fairly simple process, and actually very few side effects from the medications. And there are a number of different kinds of medicines. If you have high thyroid function, too much thyroid, hyperthyroid, there are medicines to treat that as well. There's also cancer of the thyroid, which surprisingly is common. A glandular product that it is, it creates little nodes on it, and sometimes nodules can actually become cancerous. So at times, if it's caught early, almost always it's curable. They'll go in and actually remove part or the entirety of the thyroid, which clearly would put you on replacement hormones, in this case thyroid hormone. But if they remove only the quote hot part, the part that's producing too much thyroid, the cancerous part if you will, removing that, you may be perfectly fine. And the rest of the thyroid may not require any supplementation. You may do just fine with what you have left. But even removing the entire thyroid is not something that is a scary, terrible thing. Any surgery is a little scary. But at the end of the day, it's good to be able to check and know that your thyroid is functioning, because the thyroid is your friend, and so are we. at St. Helena Women's Health Center. Thanks again for coming for our short segment on thyroid, and have a blessed day.